What is up, friends? Rob Sevilla here, the Medicare Minister with Agape Insurance and Financial Group in Tupelo, Mississippi. And today I'm going to be answering the question, how much does Medicare cost? What if I want to go off of my group insurance because I'm turning 65 and I want to go on Medicare? Is it better for me cost-wise to go on Medicare? And so I'm going to break some of that down for you here today. As you can see, there's me and my lovely wife on the screen. Once again, Rob with Agape Insurance and Financial Group in Tupelo, Mississippi. So let's get right into it. How much does Medicare cost? This is a question that we get asked all the time here at Agape. And so I want to break it down for you real quickly. And for the Part A hospitals you see here, okay, and I'll bold it there so you can see it. The cost of Medicare Part A for most people is generally zero, is usually zero. If you do not meet the work requirements, there is a cost for Medicare Part A, and I'll break that down for you real quickly. In 2023, your premium is zero for Part A if you or your spouse have worked 40 quarters or more. Additionally, if you are a federal employee on January the 1st, 1983, or a state or local employee anytime after March 31st, 1986, you would qualify for this zero premium. So let me just stop right here. Most people are going to fall into this top category. In my experience, about 90 to 95%. The second category is $278, and this is per month for your hospital or your Part A Medicare insurance. Some people refer to it as inpatient insurance as well. If you or your spouse worked for 30 to 39 quarters, equivalent to 7.5 and 10 years. The final category here is $506 per month if you and your spouse worked fewer than 30 quarters, or equivalent to about 7.5 years. Now, I want to stop here real quickly because you may be asking, well, how do I know which category that I fall into? Well, the best way is simply to call Social Security. They have a national number you can call simply by Google searching that, or you can find your local Social Security office, call them, schedule an appointment, and they will break all of this down for you. But I can't stress this enough. Most people are going to be in this zero category. So don't get scared, don't fret. That's where most people are going to be at. Now, before I jump into the Part B side, I want to stop real quickly and just let you know, if you're liking the content so far, then please take a moment to like this video. Please subscribe, turn on your notifications. That way that you are notified every time we drop content like this. Give us a comment, maybe a question or some feedback. We'd love to hear from you. And this just simply helps us help more people because YouTube loves the interaction. So if you would do that for us, we would greatly appreciate it. All right, so we've talked about the Part A hospital insurance. Now we're gonna go to the Part B medical side of things. Some people refer this to as outpatient insurance. The cost for Part B, and I'm gonna highlight it right here, is based on your modified adjusted household gross income. However, most beneficiaries are going to pay the $164.90 per month. Once again, in my experience, 90 to 95% fall into this category. Additionally, there is an annual Part B deductible that has to be met. In this particular case for 2023, that is $226. So for 2023, that annual deductible, once again, is $226. Now I put a little chart here for you on the screen, and I want to show you something because most people are going to fall into this top category of the $164.90. But I'm just going to look at one other category here real quickly. That if your income, if you file an individual tax return, and your income is greater than $97,000 and less than or equal to $123,000, or if you file a joint tax return and it's greater than 194,000 but less than or equal to 246,000 per year, then your Part B premium goes up to $230.80. You could say they're going to charge you an upcharge for this. Now, the good news is Medicare reviews this every 2 years. So you can have this reviewed, because let's just say that you've made a high income these past 2 years and you're falling into the second bracket, but now because you're retiring, your income's going to significantly drop, putting you back into the first bracket of the 164.90. You can get Medicare to review that every 2 years and get that back down to that first category. Now, once again, this will go up almost yearly, if not yearly, okay? So these numbers here that we're looking at are for 2023. And then you can see the rest of the categories there. I won't get lost in the weeds in that. You can simply Google search this as well and find this anywhere on the internet. I just simply wanted to put it in this document for you and on the screen so you could have a visual. Now, one thing I need to mention too is I get asked this question a lot, and this is another whole video, but I get asked this, Rob, can I get that Part B premium back? And the answer is yes, if you qualify for what Medicare calls, and I'll type it on the screen here, the Medicare Savings Program, okay? And that simply is if you qualify for Medicaid. So you have to have that low income to get this program. And you may have seen tons of commercials on TV where people are telling you can get your Part B premium back and you can get all these extra benefits at no cost to you. Well, what they're simply talking about is a program, or a plan, I should say, that you qualify for if you meet this Medicare Savings Program criteria. Once again, that's another video. I'll make that down the road. But you can get it back, but you have to have a really, really low income for that to happen. So let's move on to the Part D prescription plan here with Medicare. So Part D prescription plans, the cost of your prescription drug plan is going to be based on, just like your Part B premium, your modified adjusted household gross income. So just like the chart up with the Part B income there, Part B premium, it's the exact same thing down here. Most people are not going to have any kind of upcharge. It's going to be zero. So if their plan's $11.20, let's say, then that's what their plan's going to be. But once again, we'll look at the second category. If it's greater than 97,000 and less than or equal to 123,000, if you file an individual tax return, you're going to have an upcharge of $12.20. So I'll type it on the screen here so you can see it. In other words, if my drug plan is $11.20, that's one of the lowest priced drug plans right now, and I'm in this second bracket, they are going to add that $12.20. Okay? So once again, I'm not going to get lost in the weeds. You can see the graph there on the screen, or the chart there on the screen, or you can simply Google search this too if you want to make it bigger and you can see it and maybe study it a little bit more. But these are the numbers that you want to be aware of. And just like your Part B premium, Medicare can review this every 2 years. So once again, if you start off with a significantly high income, like you've been making a really high income for the past 2 years, but the next 2 years, because you're retiring, your income's going to drop, then you can go back and get this reviewed and get that upcharge drop. So once again, you can see the different categories there, and I'll let you review those at your leisure. Now, for the Part C Medicare Advantage plan, the costs for most of these plans are zero. Once again, we see these commercials all over TV, people promising, free dental and free this and no cost this and that. And the reality is, those are all great benefits to have that your traditional original Medicare does not cover. However, you really need to get with a seasoned Medicare advisor like us at Agape to fully explain the pros and cons of these plans. And I put some examples here on the screen. We need to be aware of the max out-of-pockets. This is the max amount that a Medicare beneficiary can pay in one calendar year on this particular plan. In the area where I live here in North Mississippi, the max out of pockets can be as high as $6,900. Okay, so you want to be very aware of that. That's a lot of money to have to pay out in one calendar year. You also want to be aware of the co-pays that are built in to these particular plans. Example, an inpatient copay. Some of these plans, depending on where you live, your copay for an inpatient stay for the first 7 days can be $300 a day out of your pocket. So you need to be aware of things like that. Now, the good news is you can put some plans in place to help shield you against that. But if you just take out the Medicare Advantage or Part C plan by itself, you need to be aware of these copays. You need to be aware of networks, PPOs versus HMO. PPO allows me to go in and out of the network, but if I go out of the network, I just pay a little bit higher price. And HMO is more restrictive. I can only go in the network. You need to be aware of this, especially if you're going to travel a lot when you're retired, or you go maybe see your children who live in other states. You need to be aware of this and make sure that you get on the right Part C Medicare Advantage plan. And then finally, prior authorizations. 70% of all the services that you will need when you're on these particular plans require a prior authorization, or what's known as a PA. You need to be aware of that when it comes to being put on these particular plans. And then finally, I'll just say this: there are additional costs if you decide staying on original Medicare is the best route for you. Let me give you an example. If you're going on Medicare right now or very soon, you have two main routes. You can stay on original Medicare and then add what is known as a Medicare supplement or Medigap with a separate drug plan and any other ancillary plans that you may need to fill in the gaps of Medicare. I have this down here at the bottom of the screen, okay? Or you can go the Medicare Advantage or Part C route. And that's where they basically take your medical, your drug plan, all of these extra benefits like dental, vision, and hearing, and over-the-counter benefits, to name a few, and your prescription drug plan, and they put it all into one plan. And even though those plans are generally zero or very low premium, once again, there are some pros and cons that you need to be aware of. And so as I close out this video today, what I really want you to be aware of is that we are available to help you. More than likely, we work in your local area. We're out of North Mississippi, but we work all across the country, and we would love to help you navigate Medicare because it can be very overwhelming. So you can simply call the number on the screen if it's on there, or click on the video description below, and our number and our web address will be there. And reach out to us, and myself or one of my seasoned Medicare advisors will be more than happy to help you get this whole Medicare thing figured out. So how much does Medicare cost? Well, my answer is simply this: it depends on what your needs are, what your budget is, and what your situation is. And so once again, it's better just to reach out to a seasoned Medicare advisor like ourselves, and let us help you navigate through all of the Medicare waters, if you will. So God bless you guys. I pray that you've enjoyed the value that we've offered in this video today, and we'll see you on the next video.